Welcome to The Explainer. Today, we're diving straight into a fascinating, data-driven investigation into a totally surprising hidden factor that is literally shaping our health and survival. We're looking at some groundbreaking recent research published in major journals like Nature Human Behavior and Nature Medicine. And honestly, the findings are going to completely change the way you think about taking a trip to the doctor. So, we're kicking things off with a highly provocative question today. Can your political beliefs actually shorten your life? Now, for a long time, researchers have debated this, but recent longitudinal data that's tracked the exact same group of thousands of Americans from adolescents in the 1990s all the way into their 40s in the 2020s suggests that your political alignment might be just as dangerous or protective to your health as environmental factors. To really wrap our heads around this, we need to talk about what public health experts call social determinants of health. Traditionally, we think of things like your income, your level of education, or, your physical access to a hospital as the primary non-medical factors that dictate how long you live. But growing evidence suggests that political polarization now belongs on this exact same list. It's fundamentally altering health outcomes in ways researchers are only just beginning to map out. When looking at the data from the early 2000s, liberals and conservatives actually had very similar mortality rates. But as we move into the 2020s, a clear widening gap emerges. If we focus specifically on internal causes of death, things like heart disease and cancer, the conservative groups actually begin dying at notably higher rates than their liberal peers. To make that gap a bit more tangible, let's look at the hard numbers. Between 2020 and 2022, very conservative individuals had a 1.144 percentage point higher probability of dying from internal disease-based causes compared to very liberal individuals. Now, in a cohort of people in their early 40s, a gap of over 1% is statistically massive. We are talking about thousands of potentially preventable early deaths, which represents a profound divergence in physical well-being. But wait a second, the years 2020 to 2022 immediately bring a massive confounding variable to mind, right? As objective data detectives, we have to test our hypotheses. So we start by asking, is this alarming mortality spike entirely reducible to COVID-19 infections? We all know the pandemic became heavily politicized, so does the virus alone explain this data? Well, when researchers cleanly separated COVID-19 fatalities from all other non-COVID internal deaths, the results were pretty stark. Even when completely factoring out COVID-19 deaths, conservatives, moderates, and liberals were all still significantly more likely to die from non-COVID internal causes than the most liberal group. So the gap exists completely independently of the pandemic. So if it isn't just COVID, what on earth is it? Our next hypothesis tests geography. We often hear about differences between red states and blue states, right? Could differences in state health policies, local cultural norms, or even rural versus urban healthcare access explain this widening divide? Are conservatives just living in areas with worse healthcare infrastructure? The researchers actually controlled for this using a statistical tool called county fixed effects. In plain English, they compared conservatives and liberals living in the exact same county. And guess what? The mortality gap persisted. Even when a conservative and a liberal live in the exact same neighborhood, under the exact same local policies, and with access to the very same hospitals, they still have fundamentally different health outcomes. This completely rules out pure geography as the sole cause. Section 1. The real mechanisms, demographic shifts, and the medical trust deficit. It turns out about half of this growing health gap is actually due to people shifting their political alliances over time. The data shows us that individuals who were already less healthy began moving into the conservative coalition during the 2010s, while healthier individuals shifted toward the liberal camp. So, what's driving that shift? Well, these shifting observable characteristics heavily favor liberals. Throughout the 2010s, the liberal coalition saw relative gains in education levels, higher incomes, and better access to health insurance. And because higher education and income are deeply tied to better health, as these demographics polarize politically, the baseline health of the two coalitions naturally drifted apart. But demographics simply don't tell the whole story here. If shifting incomes and education only explain about half of the mortality gap, what explains the rest? Well, something unmeasured, rooted deep within personal political beliefs, is driving the other half of this deadly divide. And this is exactly where the study turns to human behavior. A massive survey of over 20,000 people revealed a severe medical trust deficit. The data shows a distinct negative relationship, highlighting that right-leaning Americans, whether measured by ideology, partisanship, or vote choice, express significantly less trust in their personal doctors than left-leaning Americans. When we look at the actual behaviors, they are starkly contrasted. It is not just about abstract trust, it's about action. Right-leaning patients are far less likely to visit or adhere to the advice of a primary care provider. In one strikingly vivid survey vignette, right-leaning individuals indicated they'd be less likely to seek medical help even if they were experiencing severe, sudden chest pain. They are actively choosing to engage less with the medical system. This skepticism is so deep that it extends even to patients who already have diagnosed long-term illnesses. Astonishingly, the data shows that right-leaning patients with chronic diseases increasingly doubt the safety and efficacy of their own daily non-COVID medications. We're talking about things like blood pressure pills or insulin. When you doubt the medicine keeping your chronic illness in check, the risk of internal disease-based mortality naturally skyrockets. This leads to a fascinating and frankly tragic clinical paradox. Because right-leaning individuals are avoiding primary care and questioning chronic disease medications, they actually end up in the emergency room way more often. Yet the data shows that once they are in the ER, they heavily distrust and are far less likely to follow the advice of the very emergency doctors trying to save them.
Section 2, Clinical Implications: How Medicine Must Adapt to Polarization.
Because polarization is leaving conservative Americans increasingly vulnerable to preventable health risks, the medical community absolutely cannot just ignore this data. They have to adapt to a reality where political alignment is a genuine health risk factor. Public health officials must adopt new, neutral strategies focused intensely on rebuilding social trust. If medicine is going to successfully reach and treat skeptical populations, traditional communication just isn't enough. They need to acknowledge polarization as a primary determinant of health. This is going to require deep collaboration between medical doctors and social scientists to figure out how to communicate life-saving advice without triggering those political defense mechanisms.
We're going to leave you with this final, profound question, raised directly by the scientific literature we reviewed. As polarization becomes a deadly, measurable health risk, what is the ethical duty of a doctor? If a specific political alignment or the beliefs attached to it are fundamentally shortening a patient's life, should physicians actively intervene and nudge patients away from those beliefs, just as they would with smoking or a bad diet? It's a complex, incredibly challenging question, but one that modern medicine may very soon be forced to